So Adrian, we were talking about doing a little bit of a combination of both doing the microneedling and we're actually going to inject the PRP. So she had two tubes drawn, and I spun one for this, and then one we're going to actually do for her injections, and she wants to do. So it's a little bit harder when you're doing the stage. When you're in your office, you have them completely flat. I have this in a little tiny cup or a little sprayer. It's going to be much easier. You're not going to make so much of a mess. And you're literally going to start to debris until you're getting a really nice pink hue to the skin. Well, I want you to know that this will not be bad if you actually topically numb them well. 5% is really not enough. She's doing great though. It's not blood, it's just the PRP. So benzocaine, lidocaine, tetracaine, it depends on, you got to ask your compounding pharmacy. I get the strongest strength, which is usually 20, 12, and 12. I've seen them as 20, 10, and 8. Depends on what they're comfortable giving you. They might not give you that strong. But you want something longer acting and then something that's short acting.
And you call it benzocaine?
Benzocaine, lidocaine, tetracaine. BLT. Like the burger. This is the PRP. So when you're really well numb, she typically will be very bloody. You have a lot of PRP going in there. And like he said, when you're done, you don't throw out the PRP. You put it as a base, like their cream on their face. You can paint it on. You can take a 4x4 and put it on. Whatever you're comfortable doing. You can repeat this anywhere between 4 to 6 weeks. If they really have significant scarring, we've even done them every 2 weeks. If someone has like a big event they need to go to and they need much more improvement, most people can tolerate about once a month. So we typically do a series of 4 on our patients, and we do one a month. Yeah, this is a long treatment. My girls are literally this is an hour procedure for my girls. They really take their time and do the whole entire area. So from start to finish, well, yeah, about an hour and 15 minutes. I need a 25 gauge needle. So she wanted to have a little bit also done in her folds. Let me see if I can show you this. So this is what it looks like it comes out when it's cooled off. But even this, do you see how it looks like? And so if you ever use fillers, when they teach you and the reps come to your office, they go, oh, look how cool this is. And they do a little thing and they go, see, touch it. Look how well it holds up to pressure. And that's what you're going to see. So you can see how well that will hold up. And sometimes you even, if you heat it up a little longer, you can get it to be thicker. So you'll start to play with what you like. Even though these had one particular setting, we're about a minute different at my office. Ours is a little bit thicker. So this actually might push a little bit easier. Okay, so if anybody can see, you can see it kind of starting to push.
Yeah.
So hers is flowing okay. Some people, that's how you know which syringe you're going to use, right? If it doesn't push to that and you're really, really pushing hard, just go up to the next gauge. Okay, so same thing again. We're going to just go, so just do some kind of movement, something to kind of trigger. I'll try to show you the plane I'm in. Okay, so you can see if I'm flat, you don't see the needle. If I pull up, can you see a little bit? I'm pushing her dermis up. If you're too superficial, you will actually see the needle, the hub of the needle. You don't want to actually see the color of the needle or the needle itself. If you don't see anything at all, you're too deep. So just nice and slow. If you're drooping and you have loss of volume, those are fillers. So if you can, for most people, is eyes up is Botox. Below your eyes is fillers.